Hello, everyone. My name is Alicia Jackson, licensed professional counselor, and I have gathered some people that I truly respect and hold in a very high regard to have a very important conversation about what is missing in suicide prevention. In the last 2 months, we have seen multiple high-profile suicides of people of color, specifically Black people, and it really left me thinking about, as much as we do talk about mental health, we share the memes. We know that it's so important, and at the same time, it seems like there's something that's missing, and so we want to. Invite you to be a part of the conversation. We do have in the description in this video, we have the Suicide Prevention Hotline, the NAMI WARM Line, and Crisis Line, and then also places where you can find therapists of color that look like you to connect with. So we want to make sure that we're providing resources to provide assistance, as this conversation can be activating, can be triggering, and so we want to make sure that you take care of yourself. But we also want to make sure that even though this conversation can be activating, that it also still needs to be had. It still needs to be had. So I'm going to start by letting my panelists introduce themselves, and then we're going to move right into our conversation. So first, thank you guys so much again. I know I thanked you backstage, but thank you so much again for being a part of this. I truly appreciate it. I'm a firm believer that nobody has to do anything nice for you. And so I appreciate it so much. So I'll start with Kevin. If you want to introduce yourself to the listeners and people, so they can know who you are and why this conversation is so important for you.
So sure, and thank you for having me. I'm Kevin Fisher. I am the Executive Director for NAMI Michigan, which is the National Alliance on Mental Illness, the nation's largest grassroots mental health organization. I am also the CEO of EverybodyVersusStigma.com. And this conversation is important to me, of course, because 11 years ago, I lost my oldest son, Dominique, to suicide after a 3-year battle with mental illness.
Thank you. Thank you so much for sharing. As Dr. Burks.
Hello, everyone. My name is Dr. Aja Burks. I own Transformative Mind Counseling, which is a mental health group practice that's in Southfield, Michigan. I also am the founder of the Michigan Black Therapy Fund. The Michigan Black Therapy Fund is a fund that assists Black individuals within the state of Michigan to find a Black therapist within the area and provide free sessions to those individuals. Our goal right now is 4 to 6 sessions. As we continue to receive funds, we're hoping that we can continue that being a free for those who are really struggling with access, because that's a large challenge, which I know will probably be part of our conversation today.
Yes,
so I am the founder of that, and I am really excited to be here. Thank you for having me.
yes, of course. Thank you. And last but not least, Miss Dominique.
Good evening. I am Dominique Walker. I'm a licensed professional counselor in Michigan. I'm currently working on growing my private practice, Healing Matters. But prior to that, I've worked diligently with adolescents with a lot of mental health issues, ages 7 to 17. Um, and currently, I'm working with women of color to make sure that they can create this life that they desire, which I think will be a big part of this conversation as well.
Absolutely.
This conversation is really important to me because I have lost several family members to suicide and have some other people in my world who struggle from time to time. So, I want to make sure that they understand that, there are professionals who look like them who are around outside of myself. So,
Absolutely. Thank you. Thank you
mhm.
all again for being a part of this conversation. I think the the thought that I really want to dispel is that I think that sometimes we feel that suicide isn't something that um, is, or we feel like it's not as common, right? These suicidal ideation, passive suicidal ideation isn't as common, but you will be so painfully surprised to know how many people do struggle and experience that and battle with those thoughts. So, want to kind of jump in and go from stages to say, okay, big picture, and now let's kind of hone it down globally, community wise, relationship wise, and individually. Like, what are we doing great? And what are some things that we need to work on? So, societally wise and globally wise, we seem to have accepted that mental health, right, is a part of the healing process. That we need therapy. Therapy is a need. It's not a want. It's not a luxury item. It is a need. We have come to that place. So you guys, we can kind of popcorn it and jump in, but what do you feel that we are doing well? What do you feel we're doing well globally wise in the area of suicide prevention?
I'll just hop in and just share that I think that um, having conversations, creating honesty and authenticity in in experiences are helping. I also feel that the in society, since we put a lot of emphasis on celebrities, there's been a lot of individuals who have shared their own experiences,
Yeah,
their own challenges, and I think that that has helped other individuals to feel comfortable with sharing. So I think that that's been part of that's has helped, and which is nice to see.
most
And then
definitely.
also individuals like Kevin, who has this wonderful organization, right? Like
Yeah,
that I think that individuals who are creating this concept or this understanding that stigma is a thing in when it comes to mental illness,
hmm,
and creating resources and understanding around it um, has been very helpful.
agreed. I have seen that. I've seen it where you like Kid Cudi talked about being in his battle with depression, and then all of a sudden you saw this wave of black men like saying, "Oh, like we can say that, uh, we can
Mm-hmm.
say that." Oh, okay, like this rapper that I really admire and appreciate now made it cool for me to not feel like I have to have this tough exterior, but me to say like, yeah, I get sad sometimes, and I get depressed to the point where it really gets in the way of me living the life that I want. And that truly is a part of it. And even for myself, I can say I was at a place too where when I first started being a therapist, I was like, I'm going to do my job, come home, and then work stops, right? But it was truly seeing the amount of suicides that we do have, um, and how it's really on the uptick. And I said, I can't just not talk about it. I can't just not talk about it. And so definitely we've had more conversations about mental illness. But anybody else, what do you feel like we are doing well? What do we feel like we're doing that's working?
I would say I love that employers are now pushing this idea to utilize things like EAP, right? There
Hmm.
was a time where you were supposed to come to work and leave everything else at home.
Yeah.
and just figure it out, right? And so now you're seeing much more of that, especially during the pandemic. We were getting, weekly emails and memos about, hey, these services are available to you. You should really check it out if you're struggling.
Yeah.
So I think that has been very helpful. Um, and just like Asia said, this conversation, this open dialogue about what is mental health and what it looks like, and it looks different across the board. So
Yeah. Absolutely. Absolutely.
Well, and I would add that I think what we're doing well is beginning to talk about it. I think we still have so much further to go, but
Yes.
to Dominique's point and Dr. Burke's, we are talking more about it, whether it's celebrities and athletes, um, particularly in our places of employment, as Dominique mentioned. Many of our employers provide EAP or employee assistance programs,
Hmm.
but they typically focus on substance use. Are you having marital problems?
Mhm.
Those kinds of things. It's rare and to be honest, I don't remember a time before the last couple of years where employers would specifically call out, we do have behavioral health care resources. And that has been, I think, in response to the celebrities who are coming out and talking about it. Um, Unfortunately, the COVID-19 pandemic has, I guess that's one of the benefits, if you want to call it that, of the pandemic, is that we are talking more about it. We realize that our children are struggling. We realize that the self-isolation was not good for people's mental health. So we're talking more about it, which I think is great. And there are great new programs out. For example, Senator Stabenow from Michigan and Senator Roy Blunt from Missouri created what's called Certified Community Behavioral Healthcare Clinics, or CCBHCs, which for me is a game changer. And for the listening audience who's not familiar with it, Certified Community Behavioral Healthcare Clinics are federally designated clinics that will provide behavioral health care to anyone who walks through their door, regardless of the severity of their diagnosis, regardless of their insurance status, and regardless of their ability to pay. They're federally funded to do that. And this is high quality behavioral health care organizations. These are organizations that have been vetted. They had to go through a rigorous process. These are not um, the back alley, for lack of a better term,
Yeah.
of behavioral
Absolutely.
health care. And so that's game changing to me for people
Yeah.
who are afraid that my insurance isn't going to cover it. I can't afford it. This is a game changer
Hmm.
nationally. So I really have to applaud them. And so we're getting there. We're just not getting there as fast as I like us to.
Yeah. Yeah. You know what? You kind of hit it on the head there. And I think that's why this conversation was birthed within me, because there was like an impatient part of me that was just like, we're still not there yet. Like like it was really really um, boggling to me, heartbreaking to me. I'm a very empathetic person, and so especially in the area of grief and loss, and so it's just like I could not imagine. I cannot imagine. And wanting to know, okay, we're checking some boxes, but there's still some boxes that we haven't checked yet. And to hear about that service, a federally backed clinic that will provide service, a quality service,
Mhm.
uh, to individuals, no matter if they can pay or not, is a amazing start. Is an amazing start. Over the moon thrilled to hear about that, because truly, I mean, therapy costs. It
Mhm.
costs. Medication costs. It all costs. And in the land of the free and the home of the brave, we should be able to definitely provide a place for people to get the necessary care that they need to take care of themselves. So that's amazing. So then, what do we need to do? What do you feel that we still need to work on globally? And I can even imagine Kevin jumping in, because definitely the first one is stigma is still a thing, right? It's still
Yeah.
a
For, for,
thing.
for me, stigma continues to be the leading barrier that prevents people from taking the first step to seeking the help that they need. We have wonderful programs like the Certified Community Behavioral Health Care Clinics. We have wonderful people in the community like Dr. Burks, who's saying, hey, I'm going to fund it. I'm going to find a way to get you culturally competent
Yeah.
care. We have all of those things. But for me, the fact remains that if we don't eliminate the stigma associated with mental illness, people won't take the first step. And then once we get them to take the first step, then we need to have access, awareness of, and access to high quality behavioral health care that is culturally sensitive, because despite what many people like to think, um, racial disparities do exist in care.
Absolutely.
And that's a real thing. That's something that we cannot ignore. We can't say that it's one size fits all. And there's data out there. I always challenge people to say, don't take my word for it, because I can point you to the data. There's data out there that says behavioral health care for Black and brown people look very different, unfortunately, than it does for Caucasian people, quite frankly. And we have to admit that there are those disparities out there, and we have to admit that we need culturally competent care. And I love the idea, and again, I applaud what Dr. Burks is doing. I love the idea, and many people come to me and say, Kevin, can you find me a male, African-American male, or can you find me an African-American female, or can you find me a Hispanic? And I do everything in my power to help connect people to those resources. But my caution is this: I don't want, if that's not available, I don't want that to be the barrier that prevents you from trying, because there are some culturally sensitive and culturally competent professionals out there. I won't tell you that it's easy to find, but they are there. And I always encourage people, get help if you can. We'll keep drilling down and, try to get you what you want. But sometimes we don't even really know what we want. For example, I received therapy from a middle-aged white guy 15 years ago, and the color of my skin was not an issue. I received very competent care from him. I would go to him again. And so I'm not discouraging people from that, but I'm just asking, don't let that be the barrier, because we all know that there's a tremendous shortage of behavioral health care professionals, period.
Absolutely.
And absolutely in communities of color. So we're at a disadvantage. Don't let that stop you from living, as our kids say, your best life.
Mm-hmm.
Thank you so much. Yeah, it's a huge it's a little heartbreaking. I have to be honest, in regards to stigmatizing mental health, especially in places of color, where a diagnosis is a judgment, or is viewed as a judgment. A diagnosis is viewed as a personal failure, or you did something wrong, or as a parent, and that's why your child has this diagnosis, um, or I'm not taking in life well, like I'm not managing myself well enough, and that's why I have this diagnosis. There's something wrong, right? Wrong with me. Oh, I'm going to therapy. What's wrong, right? And so I think how we change even the language about therapy. It's like it is truly a part of how you take care of yourself, and in having someone who looks like you. Yes, it is an amazing experience. I've had the privilege of seeing a Black woman as a therapist, and it's truly a wonderful privilege and benefit. And at the same time, I do hear your sentiment too, that can't be the barrier, as to why you don't get the support that you need, and that the system isn't perfect too, right? The system, yeah, isn't perfect.
So I might ruffle a little feathers by saying this,
Hmm. Hmm.
but in regards to what more do we need to do,
Yeah, I
you
want you to.
you also identified systems. The what more do we need to do is we need to break down white supremacy. The reason why people have this idea or this stigma around mental health is because we have perfectionism in our ideas of how we are
Yes.
supposed to move and navigate the world, without even identifying that there are oppressive acts that have happened to Black and brown communities
Say it.
and other communities that are non-white, that that perpetuate the stigma, because since there have been oppressive acts, then we are saying we have to do more. We have to present ourselves this way. We have to do this. The system does not treat us well, so I have to do things on my own, right?
Mm-hmm.
So what we need to do is break down the systemic structures that are in the way, and and have candid conversations about why this is a problem, and why this continues to be an issue, and without being able to work as a community, as a whole, collectively, to break down systemic structures that perpetuate that this is not normal, or that you have to do more. um, it's 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 going to be a harder road, but I really feel like that's the issue. That's the
Mm-hmm.
problem, that continues to be perpetuated throughout the ideologies that we hold, because we live in a country, and we grew up in a country that we've took on the ideas and thoughts of the country as well.
Mm-hmm.
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 Yep.
And I think sometimes what we miss sometimes is separating the two, like separating our experience in this country and our mental health, like compartmentalizing it and knowing that they are both very much related,
Mm-hmm.
and definitely do play a part in how how we do see ourselves, see our family members, and then also how we protect ourselves to make sure, right, that we are safe. And we're talking about physically safe, emotionally safe, all of that, and that is very, very specifically true for Black and Brown people in this country. So
Yeah.
I don't mind you ruffling feathers, Dr. Burks, because it's a real thing. It is a very real thing. Like we're in Black History Month, right? So it's like we can't talk about slavery as if it is just something that happened, and it isn't impacting us today,
Mhm.
because they are, I mean, directly impacted how we even raise our children. Yeah, the phrases that we use is very directly affected by um, experiences that our ancestors had 400 years ago,
Mm-hmm.
and it's still even in engaging in how we engage with each other and relate with each other as well. So yes, definitely, definitely. Anybody
Well,
else would?
I'm sorry, Alicia, if I could, because
Yes,
Dr.
please.
Burke, you are my kind of person. We're going to ruffle some feathers. Um, you know, since the George Floyd murder,
Hmm.
and I think it was actually the day after, I was so proud of NAMI had just hired a new CEO, Dan Gillison, and he was the first national leader who I heard make the statement: racism is a public health crisis.
Absolutely.
Racism is real. And so we can't honestly have this conversation in America, not just amongst the four of us, not
Mm-hmm.
just in the and brown community. America needs to understand we have a race problem. We keep trying to sweep it
Absolutely.
under the rug and act like it didn't happen, or just get over it because it happened a few years ago. No, it's still happening today.
Mhm.
Racism, and Alicia, as you mentioned, slavery, we're talking about transitional trauma. This is trauma that has been passed down through
Absolutely.
generations. It's still traumatizing to be Black or brown in this country. And so that in itself
Mm-hmm.
is reason to have this conversation. And as I said before, we got to be honest. We got to quit lying to ourselves. We got to quit playing this game,
Mm-hmm.
trying to pretend that there's a one size fits all. You Black and brown people get over it. It happened. It's over. No, it's not. We're still living it every day. It wasn't 400 years ago. It wasn't 200 years ago. It wasn't 20 years ago. It's today. That's why we're having this conversation about culturally sensitive care. We're talking about it in the behavioral healthcare system, but it goes across, as Dr. Burke said, all systems. Policing. I just read an article last night, so y'all got me excited. I'll be quiet in a minute. I just read an article, I think it's out of Seattle, Washington, or Oregon, just yesterday, they had to stop enforcing their bike helmet law
Mm.
because they did a study and found out it was disproportionately being applied to black and brown people, and they were being singled out. We can't exercise basic safety without racism creeping into it. Really? So, okay, I'm gonna be quiet for a little bit.
You okay? I wanted to highlight this comment. It said, like, I heard that she said she heard a phrase and she said she may have it wrong, called cultural schizophrenia. Whereas Black people, we live a dual experience or existence that causes paranoia from the desire of respectability. And
Mm.
I said, whoa. I said, whoa. I think that we do kind of live in a space, and it was when George Floyd, when that murder was it was like Emmett Till all over again. It was catapulting this movement, and it seemed like I got so many responses from people, um, who were struggling internally and wanting to check in with me to see if I was okay, and because it was like, oh, they're not marching for no reason. This whole Black Lives Matter thing isn't really just a hobby for some people who are maybe whining and complaining about something. No, like, this really happens to Black and brown people in this country, and we talk about hypervigilance and how the Black man has to be hyper vigilant in making sure wherever he goes and is safe, and he has to, if he's pulled over by the police, he has to have his hands attended to and only can say certain words to make sure, if you're at work, that you have to be um, a certain way in order to make sure that you are perceived as non-threatening, as you're perceived as someone who is respectable and received, and so we're living in two different places, right? And then when we come home, then we can potentially, depending on what's happening at home, have some space to be ourselves, but caught in this kind of um, survival survival of the fittest space, and then really just, okay, now we can be ourselves amongst ourselves. But yes, yeah, we.
Yeah. I haven't heard the term. I've heard of the term cultural schizophrenia,
Mhm.
but in a sense of cultural schizophrenia, meaning that schizophrenia is a diagnosis in the DSM that is
Right.
Western culture.
Mhm.
If you were to go to Eastern practices, some of the symptomologies of schizophrenia would be considered something else. Not even just Eastern practices. You can even think of in Native individuals, some of those diagnoses or symptoms could be considered something else. So I've heard it from that sense of cultural schizophrenia, but the dual experience, that duality is
Yes,
real. It
absolutely.
exists and it is exhausting.
Mhm.
And if we think about the symptoms of suicide, tired, exhaustion is a part of that. So, which means that just as it increases for our marginalized individuals, um, just because that's part of this duality that we have to
Yeah.
that we're a part of, that we're just trying to succeed, or just live, really, not have my body injured or harmed or
Mhm.
anything.
Yeah.
Mhm.
It's the burden of protection, right? So the burden of protection is heavy. It's and it's carrying that extra burden makes life more fatiguing, more challenging. We're already talking about a system that's already stacked against us, and on top of that, carrying extra burdens. Um, there's definitely a time that I'm sure all of us have wanted to just say, "Can we have a moment of rest?
Yeah.
Can we get respite? Can we
Yeah.
get that for sure?"
Yeah.
Yeah.
Yeah, that's
So.
come up a lot too in conversations as I'm taking on new clients, right? Especially from Therapy for Black Girls. And I have people saying they're sitting in spaces with clinicians who are not of color and they're exhausted because they're feeling unheard again, right?
Mm.
And they're like, I don't know what to do at this point. So luckily, somebody is attempting to connect them with other resources. But, I don't want to add another thing to your plate, but did you speak up at all? That you didn't feel heard or that she's not paying attention to you because she's on her phone, like, are we actually standing up for ourselves? But I know that's exhausting too, right?
Yeah.
Another space that should be safe where you're feeling defeated all over again,
Mm-hmm.
So,
Yeah.
we've been talking a lot about how do we fix that? Like, is it my responsibility to leave a review and say this person is not culturally competent? Like, or sharing the resources that you come across with other people of color so that they can try to avoid such things. So,
Yeah, absolutely. So making sure that we're taking advantage, and I'm saying we as mental health professionals,
mhm,
now state of Michigan at least has, now we have to have a training,
mhm,
about that, making sure that we are taking advantage of that. And at the same time, I think additional work needs to be done with just educating yourself. If you're going to be providing providing services for someone who doesn't look like you, you need to educate yourself on their experiences. On their experiences.
mhm,
I'll leave this with this. I am, for those who have know, I'm a huge fan of Encanto. I think there's so much we can learn from that movie. So, but I think truly what the villain that people blame is Abuela, and I understand why that is. You know, and at the same time, she was a victim of a war that was
mhm,
happening in Colombia, and she witnessed her husband dying while carrying her three children, and so it's like understanding how that impacted her family, right? And so just as us as black and brown people, we have to understand how what we experience in our world, how it impacts us, and then how it impacts our families. It is truly I don't think we truly sit in the seat of that because it's heavy. It is heavy, and so I understand why we don't. But taking a moment to do that, I think sometimes we do the blame game, like, oh, and it's really much bigger than that, much
Mm-hmm.
bigger than that. And so if you are a mental health professional watching, definitely if you are taking and servicing people who do not look like you, taking the time to educate yourself is so, so important. Yes, we have the mandatory trainings to make sure that we're being culturally competent and sensitive. And at the same time, we need to know what our worlds look like so that we can understand how to treat and try and meet them where they are and sit where they are, for
Yeah.
sure.
And I just want to add to that with being educating a clinician educating themselves. You need to educate yourself from the point of view of your client. So you need to ask your client questions because
Yeah.
while we are a diasporic group,
Hmm.
a large group of individuals, we are not monolithic in any
Absolutely.
way. So you need to
Absolutely.
have the conversations with your clients about how this impacts them individually. And don't go into a session thinking you know it all because you read something in a
Oh,
book.
please don't. Please don't. But even too, it's even helping the client to come in and saying, "Hey, I took a moment to educate myself, and I just wanted to have a conversation with you about it because this is how it hit me, and I want to know if this is what you were feeling." And to that's one going to communicate to the client like, oh, like this person really cares about me, and then two, like it's like to the point where they're trying to really understand where I'm coming from, and what my world is like. But yes, absolutely, please don't come in thinking that you know everything, because I am so hesitant to call myself an expert on any level. I think we're always learning, we're always growing. Yes, I've been doing this for a long time, and at the same time, we are always learning, always
Yeah.
learning. So,
I think the term expert is a white supremacy situation.
hmm,
I would say.
yes,
So we say competent instead.
Yes,
Yeah.
competent. Yes,
Mhm.
I will take that word, but expert, I'm just like,
Yeah.
ah, maybe not. So let's talk about community, and what are we doing that's working? What are we doing in our community systems that's working? So we're talking about like healthcare, school, um, and our the systems that are serving right each other. What are we doing that is working, that is meeting the need?
I think the nonprofits that exist,
Absolutely.
like for instance, NAMI Michigan,
Absolutely.
having that group and other nonprofits that are out there
Hmm.
um, are very important. And I think that that's another place that's working. I also think that the ability to be able to create nonprofits, so just the being able to, someone who's like, I want to do something, and I have this vision and I want to create. So someone who wants to create a nonprofit specifically for, for instance, for suicide, right? That they still have the ability to go through that, that direction and do that. So I think that that is something that works for in regards to creation and being able to put information out there. And as a community, I do think that when we create collectives, so individuals who have groups that they're a part of, or individuals or families that maybe they're large families or maybe small families, but community within neighborhoods,
Mm.
um, I think that that works as well when we create a sustainable group to have conversations to specifically in regards to suicide. That's what we're here for.
Right.
uh, that's what I think that's works. One of the things that's working well.
Yeah.
Absolutely.
Yeah, I add to just collaboration. I know when there are things that come across my plate and I'm like, hey, this isn't for me, but I know who would do a really great job working with this client. I am consistent to see it through, and I know a lot of people around me are doing the same thing. I also say I know there's still a lot of work to be done, but getting the mental health professionals into the schools with a different, fresh set of eyes, I think that
Mm.
has been really helpful. So that they don't have to go outside of a space they're in 4 or 5 days a week. It's
Mhm.
already available to them.
Yeah.
So that has proven to be very helpful as well.
Hmm.
You know, I didn't realize when I first started this journey as a mental health advocate and activist how important it was to have people of color in leadership
Mm.
roles. But people remind me all the time it means something to
Yeah.
see people who look like them in roles of leadership. I was challenged a few years ago by a young lady who runs a large nonprofit. And she literally made it clear to me. She said, one of the reasons I support you and NAMI is because we don't have enough African American leaders. And then make, on top of that, male leaders
Absolutely.
of color in this space. It makes it okay in our community. The last couple of years, I've had more conversations and been part of more workshops that are African American male focused, where because we all men, and this affects the general population as a whole, but stigma varies. And that's my thing. I got to keep going back to stigma.
Hmm.
Stigma does vary by community and culture. And in the African American community, for a man to say, I'm feeling depressed or I'm living with anxiety. That's huge because we've been told we're protectors and providers. Strong men don't talk about stuff like that. When we know that if you don't, it could literally kill you. I came within, and I use myself as an example. I literally came within hours of taking my own life because I didn't want my wife and kids to know how much I was hurting from losing my son. And I mean, you think about that, and it's like, really, all I had to do was say something. Was say something. And I was afraid that my wife would think less of me. It was just the opposite. It strengthened our relationship. We are stronger now. She is accustomed to seeing me cry. She knows why. Sometimes she doesn't even have to say a word. She knows it's Dominique's birthday or this or that. And she embraces it and just literally says, "How can I help you?" So in our communities, we're getting there. Like I said, I'm so impatient. I want everything yesterday. you know, but we are getting better in our communities. And as Dr. Burke said, having not more nonprofits. I am huge, Dominique, on collaboration. I'm like you. I love collaborating. I love knowing what the resource is. I tell people I'm a generalist. I know a little bit about a lot of things. I don't know a lot about anything.
Mhm.
But my reputation is, if you want to know, call Kevin because he probably knows somebody.
Mhm.
Um, I feel really blessed by that. I feel really privileged that people have that trust in me. And if I don't know, I'll keep calling until I find out. So we are making progress, and we're
Mhm.
making progress in every community. Here's another really quick thing. What I've learned too is our young people are really open to talking about their behavioral health struggles, whether you're
Yes.
Black, white, Asian, Latino. we're It's the parents that are more the perpetuators of stigma than
Yes.
it is these young people. These young people will tell you in 10 minutes, yes, I'm on medication. Yes, I have suicidal thoughts. Yes, I go to therapy. They'll tell you all that. But they also tell you, my mom and dad don't want to hear about it. When I go to them and tell them I'm feeling depressed, when I go to them and tell them I'm feeling the weight of the world on my shoulders because I'm trying to perform at school and I'm trying to earn a scholarship and I'm trying to do that, our parents are saying, "You're being dramatic. You're being, you'll be okay tomorrow." And I had one young lady at a high school student tell me, she told her mom, said, "We'll deal with it tomorrow." And she had to tell her mom, "I might not be here tomorrow." So when we talk about what's missing in prevention, we're not listening enough. That's what's missing.
Yeah. 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 I think, and going even kind of piggyback on both you and Dominique, we both had the privilege of working at an organization, community organization that was really built on collaborating. So I was in a children's hospital specialty clinic. I was providing therapy inside of the clinic. So the doctor would be doing a physical, and they would maybe do a screening and say, "Oh, we really recommend your child see a therapist." And I would go right in their physical, right, and it was such a wonderful experience to have that collaboration. And at the same time, it was a little challenging, right, because the parent is saying, "Okay, doc, um, that's not what we're here for. We're just here for we're just here for the physical."
Mhm.
And so it was definitely a learning curve for them, and even coming to grips of like accepting. I think that is another layer of it. In a perfect world, I would want for and I think maybe we're getting to what needs to be done, is that just as we have yearly physicals at a doctor's office, a part of that yearly physical is even doing a psychological, like a psychological eval, just a check in to say, "Hey, how we doing?" And that be something that is a part of the system of care, like taking care of the whole person. Um, and that be just something that's just normalized, not something that's extra or like, "Oh, I'm a bad parent now because now the therapist has to come in," or, "Oh, I'm something's wrong with me now because I have to go to do a psychiatric evaluation." But no, just this is actually just a part of regular care to meet the needs of a human being.
Mhm.
Just a human being like that. That is that. If I had one wish, that would be
Yeah.
that would be my wish for the healthcare system, right?
Yeah, and you do see it with like postpartum. Like
Mm-hmm.
after you have a child, they'll do a screening with the mother,
Mm-hmm.
um, and they do it like I think like 3 days, 7 days. Like every appointment that you have with your child, they'll also do that postpartum screening. But like you were saying, if we can have that annually at their annual, physical, then I think that would assist
Yeah.
with the conversation.
Yeah, because we don't know what we don't know, right? We don't know what we don't know, and everybody with depression doesn't look the same.
Absolutely.
Everybody with anxiety doesn't look the same, especially anxiety. Anxiety is a whole thing, right? So it having a checkpoint where everybody is coming, right, to get care. It provides a space where we can educate, you know, we can educate and have a non-threatening, non-stigmatizing conversation about it, and make it more of a conversation, not an order, not a referral, but a conversation, right,
Yeah.
about it.
And so, what Kevin was saying about parents listening, even after if this wish was to come true,
Yes.
you still got to listen,
Yeah.
right? You still got to listen to what the results are,
Yeah.
um, or what has come out of that assessment. Because I don't want to say results, but what has come out of that, and really take it seriously. The number, and I don't have the exact number. I wish I did, but the number of suicides having between Black youth have increased since COVID,
Yes.
um, and that's scary for one. But we have to create spaces where it's okay to talk, it's okay to share, and um, and it's okay that something is wrong. You know?
Hmm.
So really, really quickly, Dr. Burke, you again bring up an excellent point. The most recent statistics that I've seen says that since 1999, the suicide rate in America in the general population has increased by 35%. In the African American community, it's up by over 78%. And we do know since COVID in the last 2 years, it's increased even more,
Yeah.
particularly among teen African American girls and adolescent African American boys. The suicide rate for African American boys between the age of 5 and 12 is twice what it is for their Caucasian counterparts. So, for those of us in the Black community who don't believe Black people die by suicide, want to bet? So there's so much there's so much we can do. To your point, we need to listen, and then we need to act. And when a child summons the courage to come to you and say, "Mom, Dad, I'm having these thoughts," don't blow them off. Nobody else's business. Take your ego out of it. Get your child some help, because you don't. What my friend Marvin Winans say, you just don't want to know. I tell people all the time, you don't want to know what I know. You don't want to wake up feeling what I still feel. I lost my son 11 years ago, and I still wake up days saying I don't deserve to be here. I still wake up days saying I failed him. You don't want to feel that feeling. I promise you that. One last quick thing I want to add in, and I was just thinking as Dr. Burke was talking, when we talk about annual screenings, I have a psychiatrist friend who challenged me once. We were having a public discussion about the shortage of behavioral health care professionals. And she said, "Well, no, there's really not a shortage." She said, "Because when you go to your primary care physician, that's supposed to be a part of your annual screening. MDs, medical doctors, go through enough training, and I'm not educated enough to know the hours and all of that, but they go through enough training that they're supposed to be, if you lack of a better term, the first responders.
Yeah.
They're supposed, and they are qualified to diagnose and prescribe medication for people who are experiencing depression and anxiety, and make referrals just like they make referrals for you to go see your gynecologist and oncologist. So, but that profession hasn't caught up yet. We know a lot of primary care physicians aren't comfortable doing that. Maybe they need to be reminded. We always talk about recertification and training and stuff behavioral health care professionals go through. Maybe we need to remind our MD friends
Hmm.
that this is part of your responsibility as well. That could close a lot of the gap, especially when we're talking about mild to moderate.
Yeah.
That could close the gap quite a bit.
Absolutely. Absolutely. Even my doctor, I went for my yearly physical, and I said, "Are you giving me a PHQ-9?" uh, the PHQ-9 is the depression scale, so I want to make sure everybody knows. But I think it's a place that needs to happen. It's a localized place. We all, for the most part, um, make sure that we get that in. If it's not as regular, it's a checkpoint. It's a checkpoint where more awareness, more conversation can be
Mhm.
had, and having that community partnership that Dominique was referring to was very helpful for the children in that clinic, and even for myself and for the doctors. It was a wonderful harmony that happened.
Mhm.
I was able to talk and connect with the doctors to help them understand what's happening and updating them on the case. It was a wonderful like marriage and support for that family, and so it could this can continue to happen. It would be beautiful. It would be
Well, it could be a
beautiful.
little less stigmatizing because you're
Absolutely.
getting it right from your primary care physician.
Hmm.
It's less stigmatizing because you don't have to go through another door. You're already there.
Right.
There are advantages, and it's not the silver bullet. It's just I think Dominique said it earlier. It's another tool. It's another tool in the toolbox.
Right.
When we talk, our topic tonight, what's missing from suicide prevention? That's prevention. That's
Mhm.
Mhm.
proactive. That's getting ahead of it. And saying, and when one of the things that I love about my doctor for years before I even got into this space, my doctor, when I go for my annual physical, we always took 15, 20, sometimes even more than that minutes where they would literally say, what's going on in your personal life? What are your stressors? How's your family doing? All of so I appreciated that before I even became an advocate.
Mhm.
So it's some are doing it, it's just not enough.
Yeah.
Mhm.
Yeah. Absolutely.
Yeah. I think the only word I want to add to what Dr. Burks and Kevin said was validation. Like we can listen, we can act, but there also has to be this sense of validation that I heard you and I may not understand exactly what you're going through, but I'm here to listen and support you through this.
Mhm.
That's one of the biggest triggers that our adolescents report is nobody
Yes.
gets it, nobody's listening. I've said it, they think I'm joking, move through it, right? All of these invalidating statements, and it's enough to push somebody over the edge. So we
Mhm.
also have to learn how to validate their experience and what they're going through.
Absolutely. We have to see them. We have to
Yes.
see them. We have to see them as human beings,
Hmm.
as human beings, and we don't have to like. It seems sometimes it feels like validation is condoning, right, or agreement, and
Hmm.
it's not. It's just saying, yeah, I could definitely see where you're coming from. Like
Hmm.
I get it, I get it. And this kind of pulls us to relationships, uh, relationships, and what's working. Um, and this is difficult. I think especially in the Black family, right? What's working? I think we have some level of education, a little bit, but I think there's still a lot to work we have to do, right? More conversations, but we do have some base level knowledge of, okay, mental illness is a thing. Okay,
Hmm.
I need to therapy. Okay, and then
Hmm.
like, so there's like awareness of
Hmm.
these checkpoints, right?
Hmm.
But not all the way. Like, what does it look like, or what what does depression look like? What
Hmm.
is the spectrum of that? Like, that is still where we have to go, but we do have some kind of baseline
Hmm.
of, okay, so I'll just maybe send my child into the therapist, and maybe not understanding that, oh, you as a parent are going to have to actually be an active participant in
Hmm.
your child's therapy. That part is still, I think, where we're still, I have to climb there. But definitely in the area of relationships, um, we have some baseline knowledge. But what else do we feel like we are doing well, or that we are succeeding at in this
I
area?
can speak personally. It's kind of this each one teach one kind of vibe that happens within the family. Like,
Yeah.
I went to therapy, then I told my brother about therapy, and now he's going to therapy, that kind of
Mm-hmm.
thing.
Mm-hmm.
So as we're learning, we are able to connect in a different way and say, hey, this is working and this isn't, right? And can kind of support each other through that.
Right.
Um, I would also say that we're not taking on this role that we have to figure it out for each other either. Like, I'm very comfortable telling somebody who comes to me, that sounds like something you should really talk to somebody about. Like, there's a very different brunch conversation, and I'm having
Mm-hmm.
a rough moment, and you actually need to go sit in the office and talk to somebody. So I
Mm-hmm.
think just realizing that we don't have to carry these burdens ourselves, and we're
Right.
actually able to send people out and connect with the appropriate people.
Mm-hmm. Mm-hmm. Absolutely. There's more, and then we have more language. We have more language now about it, and there's more awareness. Even, you know, and I spoke family, but even friends, like
Hmm.
connecting, like, oh, okay, you're really struggling.
Yeah.
Maybe you should talk to somebody.
Hmm.
Now that is kind of a normalized conversation. It's not viewed as probably won't be met as much resistance, right? You
Yes.
might get some,
Hmm.
but because it's because of the global conversation, relational wise, it's they may be like, maybe Dominique is right. Maybe I do need to talk to somebody.
Yeah.
Yeah, so that's much more received relational. Absolutely. Yeah.
I also think that what Dominique is also bringing up is this courage. It was the courage of herself to openly share,
Hmm.
Yeah.
and how that lend itself to someone else taking
Mm-hmm.
that in and potentially having the courage to openly share.
Hmm.
So yeah, so I think that's really important, is that
Yeah.
that takes a lot of courage to do that.
The strength of vulnerability.
Hmm.
Yeah. And vulnerability is now the new sexy, they say. So
Yeah.
it's that we have the courage to say, like, yeah, I'm going to therapy, and I
Hmm.
agree that this could probably be beneficial for you. Yeah,
Hmm.
absolutely. Relational wise.
Hmm.
Yeah,
Yeah.
I'm sure. So what do we feel is our area of growth in relationships? And we spoke a little bit about it before, with parents hearing children, even with my own, I have to remind them sometimes that, hey, when I come sit in your room, this is not a you're in trouble. This
Hmm.
is I want to have a conversation with you because your feelings are important to me,
Hmm.
and I want you to express yourself and feel free to express yourself respectfully without without the worry of getting in trouble, right? Or
Hmm.
and us have just a conversation.
Hmm.
And so that's been a great experience, right, for them. And at the same time, I have, if you see, it's a script, right, that has to happen, because I mean that sometimes that because of the parent-child, there's so dynamics, especially in the Black family. It can feel like there is no safe space. Like, feelings are just, we can't talk about them. We can't talk about how we're feeling, or how what we're dealing with is maybe related to my relationship with my parent or my
Hmm.
sibling, and that may be taken personally, or it's an offense now,
Hmm.
and so I'm not going to get the help I need because of that.
Yeah.
Well, I think, again, we're making some progress by talking about it more.
Mm-hmm.
I love what Dominique just said and what you just said, Alicia, about we being proactive in initiating these conversations and making sure that our loved one, whether it's a child, a spouse, a parent, that they understand you're in a safe place. This is non-judgmental, or as non-judgmental as it can be, because we may have intention, and I'll get into my whole disinterested third party on the next on the next call, but um, but I think we're making progress in initiating the conversation. That's prevention. I keep
Mm-hmm.
going back, and I thank you so much for the theme of this conversation. What's missing? What's missing in suicide prevention is prevention. It's proactively having the conversation.
Mm-hmm.
It's proactively validating someone's feelings, as Dominique said. Um, and as you explained, it's not that I have to agree with it. It's simply saying, I can understand how you might feel that way. Let's talk some more about that.
Yeah.
Or I understand you feel like you got the weight of the world on your shoulders because you're trying really hard in school or you're trying really hard at work. And I know it's validating that and making sure people understand that this is not a cliche. It really is a safe space to have that conversation.
Yeah.
I am so blessed, and I brag about her all the time. I am so blessed that my wife listens to me, and she does it in a very non-judgmental way. And she will literally tell me, "I don't know how you feel, or I don't know how to help you or do it, but I'm here. I'm here to listen to you." And that's where it all begins for me. So what's missing? Where are our opportunities to grow? It's being proactive and not reactive. I get really frustrated when we run the suicide prevention hotline number and there's value to that number. I'm not devaluing it at all.
Absolutely.
But think about what we always say when we give that number. We say, if you know someone's in crisis, well, why don't you help me before I'm in crisis?
Absolutely.
Help me when you see the onset. Help me when you say, Kevin, you haven't been yourself lately. Don't wait until you see me standing there with a gun in my hand.
Mm-hmm.
So what's missing in suicide prevention? Prevention.
Mm.
And can I add to another benefit of having those conversations is really looking at the generational lineage, right? Like now understanding that grandma wasn't, quote unquote, back then crazy. She had some stuff going on. It was mood stuff and it looked different from mine, but now I have some kind of context
Yes.
around why she was the way she was. And then
Yes.
why my mom felt the way she felt, right? And so just having those conversations provide so much information about things that we didn't know or didn't understand.
Mm-hmm.
Absolutely. Give you
Yeah.
a accurate sense of family history. Go ahead.
Mm-hmm.
No, I was just going to say, when we're at a space of being able to like know ourselves, know internally what's going on with ourselves, that we can also then model that for for our children, for our family, to communicate like today was a rough day, or this situation was rough, this made me really sad, and I don't need you to fix it. I just need you to hear me,
Mm-hmm.
So being able to model that conversation or use certain language to assist with that, I think is also important too. And I think that creates more of a space for that conversation.
Absolutely. 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 For us. And so, like, one, being aware of yourself to be able to communicate that. And then two, having, combining what you and Dominic are saying, like having the history and the knowledge of what's
Mhm.
happening, then kind of also gives you more data to know what's going on within yourself to say,
Mhm.
oh, okay, we got a family history of something, and now I make sense. Okay,
Mhm.
I make sense. All right. And so now,
Yeah.
too, as I can govern myself and say what I need or give myself space when I need to help cultivate healthy relationships in my home, I can also look for and attend to those same signs of things that I experience
Mhm.
or with my brother or with my cousin, with
Yeah.
my friend, and have a conversation about it, like, and from a space that is non-stigmatizing, that is
Mhm.
welcoming, that is a safe space to again cultivate the relationship and also help us to get the help that we need, you know.
I know that some clinicians are tired of genograms, but I stand by a
I
genogram.
love it.
Yeah, I
Okay,
love a genogram. Okay.
I will stand by a genogram.
Love
That
it.
visual it's so enlightening, and when a client can see, like, oh, we're talking about grandma right now, and grandma's dealing with these relationships that were conflicted, and how was there a strong lineage or strong relationship that was there. How would she know to then create a strong relationship if she hasn't experienced it, right?
Mhm.
So it's just, ooh, I love a genogram, but
Mhm.
Yes, because
but I think having those conversations is important.
Yeah.
yes, because what we're talking about is like dismantling shame, right?
Mhm.
Because what happens is a client comes in and says, it's me, Dominique, it's me, Asia, it's
Mhm.
me. I'm the reason why I'm this way. And then when we do a when we get an accurate sense of family structure, family history of mental illness, substance use, then we say, oh, it didn't start with me, right? It's not just a book, like it's a reality. It didn't start with me. This is a huge pattern in my family that I didn't
Mhm.
even know was happening, and I'm blaming myself for all of it.
Mhm.
And so it definitely it helps to give clarity. It helps to give clarity, and I think that's the one of the most powerful, weapons that that happens in therapy is clarity. Once a client has the light bulb, when you see it, it's such a beautiful thing, and they're able to see and navigate their world. And what you're talking about, Dr. Burks, like able to say, okay, all right, so yeah, and I had that moment. I called my mom and I realized, okay, she had a day. So I ended the conversation, because I didn't want that to go too far. And I took care of myself, and, so they're able to know how to navigate these relationships right from a healthy place and give each other grace, right?
Yeah.
Give each other
Mhm.
grace.
Hmm.
Yeah,
Yeah.
absolutely. Absolutely. So this will be interesting. Individual. So taking care of self, and I, anybody tired of self care? Anybody? Okay.
Love that.
Anybody tired of
I
self
have
care?
my thoughts on self care, but we can get to
I'm gonna have a moment of transparency and say, as a therapist who's been doing therapy for the full pandemic, I am tired of self care.
it.
I had to do even a 4-week presentation on self care during the pandemic, and I was just like, huh. But yes, so individually, we have language. I think that's what's working. We have language. We have allowed people. We've given them permission to say, "You can take care of yourself."
Mhm.
Right. What else do we feel is working? Because I'm almost feeling Dr. Burks from Atlanta pulling me to say what else is the other coin, the other side of that. But
Uh-huh.
Mhm.
but yes, we have given people the permission to love themselves and take care of themselves. What else do we feel is working?
I do think people are attempting to be more intentional.
Hmm.
The rest of my comment is about what needs to change, but I do think people are doing some more reflecting and being more aware of like, oh, I'm exhausted. Like this is a
Yes,
lot. So I do think more of that is happening.
Yeah.
absolutely, absolutely.
Well, but before I let Dr. Burks ruffle some feathers, I'm,
Yes.
I will say this. You're right. We are giving people permission, and we're saying the words. I just don't know if people are bought in to the
Mm.
to the fact or the notion that self-care is not selfish, particularly to my brothers, to my
Talk
men
to me.
friends out there. We really need to embrace self-care and being able to walk away from situations that we know are not good for our mental health,
Mm.
um, whether it's work, relationships. When I say walk away, I ain't talking about leaving nobody. I'm talking about situations and how we manage them and say, you know what, I need to back off this for a minute
Yeah, yeah.
and take care of me. So we're saying it, but I don't know if people are embracing it and doing it. And again, specifically amongst my men folk. So I'll leave it there, and I'm going to let Dr. Burke. I'm going to yield the rest of my time to Dr. Burks.
Yes, Dr. Burks. So we'll let you start off because I can feel the passion coming. What? Yes. What
You
more do we
know,
have to do?
you know, I just self care is important. We do need self care. We have to vitalize ourselves. We do. Um, self-care has also the term or the terminology that's been used has been kind of on the sense of, like, I don't want to say gimmicky, but that's the word I'm just going to use for now.
Mhm.
So, the bubble baths,
Watered down. That's
yeah, it's just really just kind of like, take your time and do this. And it's way more, self-care is way more than that. And it's a big challenge. And I don't think that that's, people say, oh, go take care of yourself. It's like, that's actually hard to do. If I'm actually not taking a bath, I can go take a bath, but taking care of myself is actually a hard thing to do. And so I think that it's something that is not, it's talked about in a sense of like doing physical things for your body, but not necessarily the 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 real stuff, like the deep down things that you really need to do, that that really means that you are cultivating yourself, your body, your mind in a way that's going to sustain you for a period of time.
hmm Yeah, I think the most accurate definition of self care I heard, and I shared it, was like giving your inner child what it didn't receive. That is self care. And I think if we think of it on that level, it goes deeper. It's much deeper than a bubble bath, a massage, a foot rub, a pedicure. Because even those cliche, are common ways to, so that leaves out a man. Not saying a man doesn't get a massage, but typically, right? If a man's hearing that, they're like, I don't need all that. Like that's really what comes from, and it's bigger than that.
Mhm.
If I think if black men had an honest conversation with their inner child about what they didn't receive, there'd be a conversation about like, oh, what do I need to do different? Sometimes I need to listen to myself. I need to, so I was ignored, or I need to sit with my feelings because I was told to man it up, suck it up. And
Mhm.
so we self care is multifaceted. There are 7 different areas that we need to take care of ourselves and more, and it goes deeper than that. And I think that is like education. That's really sounds like educating ourselves on how we truly take care of ourselves.
Yeah.
Mhm.
How we truly take care of ourselves.
'Cause you can be engaging in self-care by creating some boundaries,
Mhm.
right?
Say
Well,
it.
I was just thinking, so, and I'll put my business out there. Um, so about a year ago, my daughter and I had a bit of a disagreement, and she says, "Well, you're really controlling," and I tend to I do a lot of self reflection, and so the next day I went to my wife and I said, "Do you think I'm controlling?" And she stopped and said, "No, you're not really controlling." She said, "But you can be very dismissive." And I thought about it, and initially it hurt my feelings. But then when I really thought about it, I was like, no, you got to own who you are.
Yeah.
I am. I literally told her, I said, I want you to make me a shirt. My wife makes all of my Everybody versus Stigma apparel and stuff. I said, I want you to make me a shirt. First, I said, I just wanted to say, I am dismissive. And then I came back and I said, no, I wanted to say, I am unapologetically dismissive.
Mm.
I am dismissive of things that I think harm my mental health. I will walk away from situations. That's part of my self care,
Mm.
is walking away from situations and people sometimes that are not good for me, that are not good situations for me. And I tell people, so you can take it as arrogant as if you want, but that's part of my self care mechanism.
Mhm.
It's not that I'm better than you. It's not that I'm smarter than you. It's simply you're not good for my mental health. And in reality, I'm probably not good for yours either. So I'm doing us both a favor by
Mhm.
walking away. And people take that, and there doesn't need to be an argument. There doesn't need to be a curse word. I just quietly remove myself. And people will literally, you haven't called, you haven't done it. There's a reason for that.
Mhm.
So no, you're right. Self care is more than listening to music or doing yoga and all of that. We have, and Dr. Burks, I'm glad you brought that up because it's really about doing the hard work. It's really about eliminating some of those things in your life. It's really about being able to say, you know what, maybe I do need to see a therapist. It's about it's creating peace of mind.
Mhm.
And so it could be taking care of your finances better because financial stress causes a lot of problems. And some of it is, I always tell people, it's not how much you make, it's how you spend what you make. It's how you manage. My dad used to tell me when I was very young, he said, if you can't manage a little money, you can't manage a lot.
Mm.
Mm-hmm.
So when I talk to people a lot and people say, well, I'm under all this pressure, I say, wait a minute. How are you, what are you willing to do about it? It's easy to complain about it.
Right.
But are you really willing to do the hard work? Are you really willing to make change that will bring you greater peace of mind or increase your self care?
Mhm. Absolutely. Absolutely. And I know sometimes I think there's a part of me because I always like want to give people the benefit of the doubt, right? So, want to say, man, self care. We have this language, and at the same time, too, um, there are sometimes these high expectations too, right? So these high expectations that we even have of ourselves internally, and not managing or seeing what having a healthy boundaries with yourself. We always talk about with other people, but healthy
Mhm.
boundaries with yourself looks
Mm-hmm.
like.
Mhm.
I had to have a meeting with myself just today because Alicia gets so excited. I want to do everything and help everybody. And that's just not possible. It's not fair to Alicia that I do that. And so I had to say, hey, we have to reel this in.
Mhm.
We have to reel this in. And you cannot kill yourself because you said to yourself, you've been doing therapy for 2 years in a pandemic. So you cannot do this. Right. And so I had to reel myself in. So, like, having this internal struggle, right? Of like, okay, self care, but ooh, I gotta, there's the buzz. Everybody wants to be an entrepreneur, have multiple streams of income, and all of this, and so it's like battling these two worlds and finding balance and setting boundaries with people. When it's time to say, okay, this situation isn't working well, right? And doesn't mean that I don't love you. It doesn't mean that I don't care. It
Mhm.
just means that I need some space,
Mhm.
and at the same time too, having that balance with you as well, with managing our expectations because of going back to Dr. Burke's the idea or the idea of perfectionism, right? That comes from white supremacy. It's like ingrained, right? So we to cover up the shame, we have to be perfect, right?
Mhm.
And then that puts a space for us where we if we make one error, if we make one mistake, we there's no compassion there. There's no
Mhm.
grace. There's no grace in our relationship with ourselves. And
Mm-hmm.
so even that in itself is practicing self-care, having really
Mm-hmm.
compassion for ourselves helps us to have compassion for others when they also make a mistake because we too do it as
Mhm.
well.
Mhm.
Yeah.
Yeah. I always talk to I share with some of my clients who need the conversation or as part of their work, is being their own best friend.
Mm, absolutely.
And so you have all this great advice to give your best friend, your bestie.
Yes.
So
Mhm.
what does this look like for you, right?
Yes,
How
I
do
like that
you be
language.
your best
Yeah.
friend? And showing up and being and existing in that space with yourself, having the conversation with yourself, because you got to. I mean, for you to cultivate that relationship with your external best friend, you showing up,
Mm-hmm.
you're engaging, you're talking to them,
Yeah.
Mhm.
you are participating in the, like you're a part. This is a joint, a dual relationship. So how about you do that with yourself? What would that look like?
Mm-hmm.
Mhm.
Mm-hmm.
Um, and when people start to engage in that, then they're really thinking about themselves a little bit more, right?
Yeah.
Thinking
Yeah.
about how how is that working? Or they're about to do something and they be like, sis, you
You
know
already know
that
that's not it.
you already know that ain't it.
Mhm.
That's not it. Like,
Mm-hmm.
that's not a good idea. Yes. I have a be kind sign in my office, and my clients always thinks it's about other people. And I said, no, this is about how you be kind to yourself.
Mhm.
Yeah. How do you be kind to yourself? How do you talk to yourself?
Mm-hmm.
And I know all of us have an inner critic, like all of us have that. And how do we help our inner critic to soften its voice, right? To soften its energy, and to also get to a place where we accept ourselves. And that's truly, I love that language, how, being your own best friend. It's a great framework because sometimes self-love and self-compassion is like, what does that look like?
Mm-hmm.
But we've seen what good friendship looks like. We have these terms, ride or die, right, for a reason, BFF for a
Mhm.
reason, because we know what that looks like. We have been that and received that. And so that is great language to help us navigate how to be that for ourselves. That's
And if we
awesome.
haven't experienced a good friend or
Hmm.
a good best friend, we know what we would want
Say
from
it.
a good friend, from a
Mhm.
good
Yes.
best friend, and we
Hmm.
can do that for ourselves too.
Hmm. Hmm. Absolutely. Absolutely. Well, I just, again, I'm going to thank you guys over and over again for being a part of this conversation. I think the more we have conversations like this, that we talked before, the more knowledge, the more awareness that can happen about what is missing in suicide prevention. I'm appreciative of even everyone sharing their story and how this has impacted their lives personally and even professionally. Suicide is absolutely preventable. It's absolutely preventable. It is
Alicia,
absolutely preventable.
Alicia, I know you're wrapping up, but I just
Hmm.
wanted to say this one thing because we've
Hmm.
we've been talking about language
Hmm.
a lot, and language is so important.
Absolutely.
We're having having that conversation and communicating about what it looks like, and I think that that's also something that is missing. Is although we're engaging in more language, I think we need to recognize the language that individuals are using when they're talking about what they're going through, and being able to recognize that as this is something different, this something else is going on, and being able to
Hmm.
connect to those, and also think of language as in like shared language that you have with that person.
Hmm.
So not just like the mental health language that we use and here, but also how do we the shared language that we use, and when we're talking about anxiousness or anxiety or depression, because we might not be using those words, we might be
Right.
saying something else, and being able to connect to
Uncomfortable.
those.
Right.
Right,
Yeah.
right,
I
and
ha-
being
I
connected.
have I had and this would be really a lot with my teenage male clients. Anxiety was just something. I'm not anxious. I'm not anxious. And like, but I'm like, oh, but I noticed you said that you don't really like social settings, or you don't. No, I just just it don't feel right. Like so sometimes it's something you have to, as a therapist or as a mother, as a auntie, as a grandmother, have to be able to kind of tap into, because anxiety in certain settings, right, are going to be like, no, I don't experience anxiety. No, that's not me. But then uncomfortable. Oh, what happens? Well, my heart starts beating fast, and or like I get nauseous when I have to be in social settings. Okay, well that's okay, and tapping into that language.
Mhm.
Now then I was wrapping up, but then you start talking about language, and it made me go somewhere else.
I'm so sorry, everybody.
It made me go somewhere because we have vocabulary, because of social media. I feel like that's something we missed, in the societal thing of what's working. That it is. I think social media it's a complicated one, right? So it's great. It is great. It pushes the information out. We have we are streaming on two different platforms at one time. I don't even know how it's happening, but it's happening, and and that is great to have this conversation in this public setting. And at the same time too, I think with a lot of education, sometimes when we learn words, and I know for definitely for I don't want to speak for you guys, but I know for me, I'll speak for me. Words like toxic, manipulative, narcissist, imposter syndrome, like these words,
Gaslighting.
it kind of it brings a shoulder. Like it makes it's because they are buzzwords, right? They're buzzwords. Sometimes it can create a lot of um, I'll say a lot of just there's more conversation needs to be had around these words. I will say that there's
Mhm.
more conversation needs to be had about these words in a place that I believe where compassion and clarity needs to be there as well, and it will help us in our relationships with others and ourselves. I think no conversation is going to end well with you're a narcissist, right? No conversation is going to end well there, or you triggered me, right? I think we have a that's an area of growth for us on
Mhm.
how to navigate, use the new vocabulary that we've learned to continue to learn more, and to also figure out how we can use this information to help us in our relationships. But
Mhm.
that's when you start saying language, it made me think of that because yeah, it's a pet peeve.
And since you said language, another area of growth, which I think some people kind of stray away from, is actually having a real conversation about, are you thinking about killing yourself? Do you want
Mm,
to die?
yeah,
I'm very comfortable having that conversation. And
same
parents are
here.
looking like, did you just ask her that? I did because I want to know. Because if she
Hmm.
is truly thinking about it, I want to try my best to assist her. So
Yeah.
I know it's, a kind of taboo thing to do, but sometimes you really need to know because these kids they're thinking about it. They're
Hmm.
processing. Some of them do have a plan. So
Hmm.
we want to try our best to check in where we can.
Well, and Dominic, to your point, we
Hmm.
know that that directness can be the difference between life and death.
Yes,
We know
Absolutely.
that if you try to shoot, oh, honey, you're not thinking of hurting yourself. They're gonna say no, because I know you're not ready for the answer.
absolutely.
But when you're direct and say, are you having suicidal thoughts or do you have a plan? That directness can literally be the difference between life and death.
Yes.
Hmm.
Mhm.
Hmm.
Yeah.
Absolutely.
Right.
I
Don't put her around, pitter patter around death.
Yes.
no,
Yeah.
no,
Ask the
no.
questions.
I let my clients know. I say, hey, we're gonna talk about it, and it's only because it's so important for us to have a temperature check of where we are,
Yes.
because. And I'm gonna get into my IFS world, but the suicidal part has a story, and so we have to talk to it. We have to figure out what burden is it carrying, and I
Mhm.
think that is the reason why unfortunately we saw those deaths that happen when we you think, oh, the mayor of Maryland, he's loved by all, why would he do this to himself? Miss USA, the
Mhm.
when that year 2019 we were so geeked, all black everything, right? And so she's in this light, and she's glowing, she's still working, right? Like she is, what why? But the suicidal part is carrying a burden, and it's tired and fatigued, right? We talked about how because of the color of our skin, we have extra burdens that we have to carry because of that. So tapping into that and having that conversation, being direct, is so important. And
Mhm.
like Kevin said, it could be a matter of life and death, and we have to be more welcoming to that conversation. And if you're watching and you don't feel safe having that conversation, connecting with someone to support you with having that conversation, reaching out to a mental health professional to have that conversation, because it we need to keep having these conversations. It doesn't stop. Once this speed ends, it's like, okay, that was nice. Those four people, they really knew what they were talking about. Or maybe you might think we don't, and then close it. But no, we still need to keep this conversation going. It doesn't end because the live feed ends. It needs to start happening in your home. It needs to
Mhm.
start happening internally within yourself. Um, because we all are going through this thing called life, and it's not easy. It's just not. It's not. So I do thank you, and I appreciate you, Dr. Riss, for interrupting me, because that I think that is important conversation to have, and it's as long as we create the space for it, and keep giving the permission, then someone might say to themselves, maybe I will. Maybe I'll check in with my kids. I'll open the door. I'll take off the headphones and have a conversation. Right. I will. Our world and society is so me focused. We got our earbuds, our AirPods, or whatever, and we're just in, right? We have our worlds. We have now it's all virtual, right? Everything is in, but the more we're isolated, studies have shown that is definitely a risk factor for suicide to happen. We are meant to be connected. We are meant to be connected. So definitely take time to connect. Anybody have any last words? And please tell our listeners where they can find you. And I'll start with you, Kevin.
So again, I want to thank you for inviting me to be a part of this conversation. You were right on point, perfect time, perfect conversation, great panelists. Dominique and Dr. Burks, has really been my pleasure. If there's anyone who is in need or even have questions about mental health care, please reach out to your local NAMI. You can reach NAMI at 800-950-6264. In Michigan, you can reach me at NAMI Michigan at 517-485-4049. And so please be proactive and let's be preventative. Thank you.
Dominique?
Yes, I agree. Thank you so much. And this is my first time engaging with Kevin, so I'm super grateful for that opportunity. But yeah, I'm happy we're having this conversation. It's a real thing. I would like to put in two plugs if possible. We talked about our MDs doing more and being more competent and willing. I have a special friend in Atlanta, and she just left a mental health kind of training. It's like a 5-day training. It's through the Reach Institute. So she gave me permission to share that, said it was super helpful and it's helping her to assist more of her patients. So that's something that is a resource. Also, for our kiddos, our adolescents, 7 to 17, the Children's Center does have a DPT program, which has been great with helping some of our kids shift those thoughts and prevent suicide. So I'm overseeing that program right now, and I'm just grateful and looking for you guys to come in so we can help. But for myself personally, you can find me at www.myhealingmatters.com. You can leave inquiries there, consultations, or just call. So grateful again. Thank you.
Yes. Dr. Burks.
Thank you so much for having me. I really appreciated this time. I also am someone who gets rejuvenated by conversations like this. So I appreciate you creating a space for this, Alicia. The one thing I would like to say before sharing some information is that as Alicia was talking about where we're all thinking about ourselves, the personal, the you, our society. Not to bring up white supremacy again. It's all about individualistic abilities, right? So it's all about the individual, and the individual getting ahead or doing the best for themselves. But we strive on a collectivist, especially in the Black community, collectivist society, and being part of a community. So creating space to be in your community, to be engaged, eliminates opportunities for that isolation. So really, really getting engaged with even if it's not your, a large community or, your neighborhood, but just being with your family, also is it's a part of the healing process, or creating your own family. Maybe your family is not the family that you get the most out of, but creating a collective of individuals that bring you joy, is going to be very beneficial. That's how we thrive. That's how society should thrive. We just don't live in that society as a majority group. So I just wanted to share that. My information. You can or I Again, I own Transformative Mind Counseling. There are 7 clinicians that work there, and you can find us at transformativemindcounseling.com. Very long name, but it's there. And you can also get access to the email, which is info@transformativemindcounseling.com. Also wanted to share the Michigan Black Therapy Fund. So if you're an individual who is trying to access care, and you're having a hard time finding an individual who looks like you and that is very important to you at this moment in time, you are able to look through the listing of individuals who are on that, or clinicians who are on that list, and sign up and get at least 4 sessions free with that clinician. The clinicians are aware that you'd be using the funds, because you would let them know that. And they've all, since they're on that listing, they've all agreed to that. So that is an option as well. To find that information, that is miblackTherapyFund.org, miblackTherapyFund.org.
Thank you. Thank you. So much for spending time to have this conversation. There are resources out there. I think that is the most important thing. Even though I think logically we know that there are resources out there, sometimes we're in a space emotionally that gets lost. It feels lonely. It feels like, um, how do I navigate this by myself? And so, thank you guys so much for sharing those resources. I have the information for the Black Therapy Fund, but Dominic, make sure you give me the information for Reach Out, so I can make sure I can put that in the description. But I truly, truly appreciate it, and I also add everybody versus stigma too, because it's so so important. So I'll make sure I get those in this video for everybody to have that information. Please, 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 if you are struggling, and I'm going to even say, to echo, Kevin as well. If you're struggling, and I'm saying struggling, like not waiting to or getting to the space where the pain is unbearable. If you are just struggling, like this, okay, this is day one, I'm not okay. Day two, I'm not okay. Day three, I'm not okay. Sometimes I put it in the language of physical health to help people understand. If you had a headache that was like for 2 weeks, you would be like, I need to call my doctor. Like something's wrong, right? Like I think we have that. But if like I've been depressed for 2 weeks, like that is something that needs to be to be attended to. We are vessels. We are like, I believe we are like have to move. Things have to move through us. We aren't great containers, and we are not. We try to be, but stuff leaks out when we try to contain things. And so, if you're experiencing something for an extended period of time, then we need to please seek help, so that I know the pain is can be unbearable at times, so that we can continue to have these conversations. We can continue to grow and thrive together. We can continue to meet the need. I'm a firm believer that purpose is powerful, and there's pain in purpose, and that we can use that pain to really flourish and make this world a better place. I know it sounds corny, but it's really true. Um, and to, even if it's not a global world, it can be even your nucleus world, right? Your family, your internal world, to make that a better place, right? So thank you guys so much for watching. Take care, and as always, be cool, be calm, be sensitive.